Senaria Nattokinase is a dietary supplement marketed for cardiovascular support, healthy blood flow, and plaque-related pathways. The product contains nattokinase, an enzyme derived from natto, a traditional fermented soy food that has attracted scientific interest for its potential effects on fibrin and cardiovascular health markers. Senaria promotes its formula as a high-potency supplement containing 10,000 FU per serving, and frequently references research suggesting meaningful cardiovascular benefits. Now, this review of Senaria Nattokinase is based on independent research to help viewers avoid scams, and save time and money when evaluating cardiovascular supplements and health-related marketing claims. The first thing that stands out is that nattokinase itself is not a fictional ingredient or a made-up wellness trend. It has been studied in scientific settings, and some research has produced interesting findings. One frequently cited study reported a 36.6% reduction in carotid artery plaque under specific clinical conditions. Importantly, that study involved controlled circumstances and dosing levels that appear critical to the observed outcome. According to the available data, lower doses showed no measurable plaque reduction, suggesting that dosage may play a major role in whether benefits occur. Senaria's 10,000 FU dosage is relatively close to the effective range referenced in that research. However, the investigation becomes more complicated when examining the company's marketing claims. One example is the assertion that 80% of competing nattokinase brands failed potency testing. Based on the provided information, external testing reported that only 3 out of 8 brands failed, which would be approximately 37.5%, not 80%. In addition, Senaria itself was not included in that testing group. This creates concerns that comparative statistics may be exaggerated beyond what available evidence supports. Transparency is another area where questions emerge. Although the product reportedly displays third-party testing claims, no accessible certificate of analysis has been provided in the available information. Without publicly verifiable laboratory documentation, consumers have a limited ability to independently confirm potency or quality control standards. Review credibility is also worth discussing. Reports indicate that the brand accumulated more than 17,000 reviews despite being a relatively recent market entrant in 2026. While high review counts are not impossible, the timeline creates questions regarding how such volume was achieved so quickly. Another important consideration involves safety. Individuals taking anticoagulants or blood-thinning medications such as warfarin or Eliquis should seek professional medical guidance before using nattokinase-containing supplements due to potential interaction concerns. Overall, the science surrounding nattokinase appears more credible than many supplement ingredients. However, the available evidence suggests that Senaria's marketing may be more aggressive than the underlying verification data. The ingredient itself is scientifically interesting, but several promotional claims deserve careful scrutiny before purchase.